Today, we're venturing into the world of autism therapy and shining a light on the incredible work being done by dedicated professionals. Joining me today is a truly inspiring individual, Keisha Wells, the owner of Elite Spectrum ABA.
Hi, Ross. Thank you for having me. How are you?
Yeah, I'm doing great. Yeah, thank
Good,
you.
good. I'm excited to be here.
Well, good. I am too. Keisha, before we dive deep, tell us a little bit more about your journey. What drew you to the field of autism therapy and motivated you to establish Elite Spectrum ABA?
Well, honestly, I've always liked working with children. I can remember just being a teenager, and it was like children and like the children's church at my home church that I grew up in would just gravitate towards me. And so for the longest, I thought like maybe I wanted to be like a child psychologist, but I was living in Atlanta and my friend and he was like, "Hey, I work at this clinic for children with autism. I think you'll like it." And so I applied, had an interview, first day, and it was just like the doors opened and I was like, this is where I belong. And so I've been doing it since 2010. And so working there and then being able to be a part of other clinics and getting experience, it allowed me to, decide like this is the path I want to go on. And so I decided to open Elite Spectrum ABA.
Awesome. Yeah, that's great. So, as the owner of Topsite Marketing, I'm proud to, be partnered with Elite Spectrum ABA, and we've been doing it for some time now. Can you tell us what sets Elite Spectrum ABA apart from other therapy centers?
One of the things I think that really sets us apart is the fact that I would just say, like, from my experience, I started as a behavior tech, then became a registered behavior technician, and then worked my way to become a behavior analyst. And so I really got to see the intricate, like, ins and out of what it takes to provide quality behavior therapy. And so with Elite, that's what I brought to the table. Like, I knew how I wanted it to go. I knew that, it takes a village to do what we do. So that is, working with the parents, working with, whoever is helping take care of the child and things like that. And our approach with it is that I want it to be natural, not trying to, get children who are like just doing a lot of rote responding or sounding like robots, but the goal is for them to be able to function in their everyday life within their community. And so that's what I really wanted to do. And I believe we've done that. So,
Yep. Well, that's awesome. And that's the power of owning your own business and having that vision and foresight. So throughout this conversation, we'll explore about what autism is, how ABA therapy works, and the incredible impact that Elite Spectrum ABA makes on the lives of children and families. We'll delve into some common questions and misunderstandings surrounding autism, offering valuable insights and resources for our listeners. So, Keisha, are you ready to unlock the doors, understanding the support for individuals on the spectrum?
of course, let's do it.
All right. Well, buckle up, listeners, because we're about to embark on an informative and impactful journey with Keisha Wells. She's the heart and soul behind Elite Spectrum ABA. So stay tuned. We're going to go ahead and get started here with just answering some, common questions and definitions. So, in general, or even specific, can you tell us what autism is and, briefly explain the core characteristics and provide some examples on it?
Yeah, of course. So, autism spectrum disorder, or ASD, or autism as you may hear it called, is a developmental disability caused by differences within the brain. And so it can look different for everyone. But typically, what you will see is that individuals have deficits when it comes to communicating, when it comes to understanding how to do different behaviors, how to respond to individuals. So you will see that some are nonverbal, some are verbal, but a lot of individuals with autism, communicating, interacting, and then they learn in different ways from most people. So that's what we see.
Yeah. Okay. Yeah. Like learning in different ways. So, what about the common symptoms whenever it comes to age groups? How does that come into play?
they say that autism can be detected as early as 18 months of age. And that's when you really start to see some milestones that your child should be doing, starting to say some words here and there. They should be walking, being able to feed themselves. And then, of course, by two, you should be able to start getting some of those full sentences, even if it's like maybe, three or four words here and there, but they're able to put those sentences together. Again, they are toilet trained and stuff like that, eating on their own, trying to do things, trying to communicate in some form of fashion with you. And so whenever we see like that's not happening, that is when, it is like, okay, let's maybe go talk to the pediatrician. Let's see what's going on to see, is this something, does my child have autism, or, is it something else? And so
Okay.
that's where the diagnosis come in at.
Got so yeah on the diagnosis then. So what is the diagnosis? Can you mention about the screening tools and the diagnostic procedures?
So typically for with ASD, when it comes to diagnosing it, of course there's no medical test like a blood test or anything to diagnose autism. But what your pediatrician or what your neurologist will look at is the developmental history and behavior of your child. So they will see, maybe again how I was talking about those milestones they should be hitting. And so if they do, or if they're not hitting those, that is when they would do their screening and their monitoring. And so a lot of times you would see, I believe it's called the ADOS. And so that's one of the screenings that they would do. It's a developmental screening that they will do. And it's going over those milestones, it's talking to the parents to see like, okay, what do you see? What has been happening? What's been going on? And things like that. And so it's questions about language, movement, thinking skills, behaviors, and emotions. And from there is how they would give the diagnosis.
Okay. And did you say ADOS? Is that like ADS? Is that what you
EOS, yes. So,
ADOS? Okay.
mhm.
Can you explain that?
So that is one of the developmental tool screening tests that they will give, and is usually with the pediatrician, your child, and the doc, and yourself. And so a lot of times the one who's doing it, again, like I said, is your developmental pediatrician, your child psychologist, and usually that's who does it. And so if you suspect that, I believe a school psychologist can do them as well. So like if your child is maybe in kindergarten or preschool or something like that, and the teachers and them suspect. So they'll tell you like, hey, I think, it'd be important for us to go ahead and go down this path.
Okay. All right. So yeah, and I see a lot of this has to do with, spotting the behaviors and stuff. So A standing for applied behavior analysis. So can you explain just more about that term and its core principles?
Yes. So basically, what ABA is, applied behavior analysis, is a type of therapy for individuals on the autism spectrum. And so we are really, like it says, we're working towards the behavior. We're wanting to change the behavior of social significance. So my job is, making sure that you're able to brush your teeth, you're able to communicate in some way, you're able to do things that's going to allow you to function within your environment. So,
Okay.
ABA therapy basically applies to how we understand the way behavior works in real situations. And our goal is to increase those behaviors that, that are socially acceptable, and then decrease behaviors that aren't. So those can be, maybe things like you have, maybe you have some behaviors like self-injurious behaviors, throwing, elopement, things like that.
hmm Okay. So I see what that is. And I guess you're explaining some of the benefits of ABA,
Mhm.
but can you elaborate more on that and provide some examples of that and positive outcomes, perhaps?
Yeah, of course. So with ABA therapy, our goal is to decrease those problem behaviors that you may see, and then to increase those positive behaviors. Our goal is to increase language and communication skills, help increase attention and focus, social skills, those types of things. So with ABA, it is I guess I can say it's a flexible treatment because we it's geared towards what you need. So with each individual on the autism spectrum, we know that they're all different. So then your treatment plan, your ABA therapy treatment is different, is designed just for you. So it's not like a
Okay.
one size fit all. It's really, okay, we see that you're able to talk, you're able to communicate with us, but you have meltdowns when you go into a store, or your parents have to rush to go do their grocery shopping and things like that. So now we're going to work on that behavior of, now the parents can go to the grocery store with you and shop without you trying to elope or having a meltdown and stuff. So,
Yep. Yeah,
mhm.
that's definitely a positive outcome right there. So help me understand, like, I hear Asperger's syndrome, also hear ADS, or, the autism disorders. What is the similarities and differences, with all these terms here? Are they the same? Are they a little bit different?
So they are a little bit different, like you just said, the Asperger syndrome. So it is a form of autism. A lot of times, what you see with Asperger's is that the individual has a hard time relating to other people socially. So they also may have some repetitive behavior patterns and maybe not interested in a lot of things. So again, it can be they're typically, they typically say that individuals with Asperger's are that of higher functioning. So they can do a lot of things, but they may speak to you in a very flat tone, or they may just have trouble reading those social cues and emotions.
Okay. So
Mhm.
yeah, with the Asperger's, they can perhaps maybe even speak very well, but maybe on the social
Yes,
side, they need some help there.
yes, yes.
Okay.
Mhm.
All right. That helps a lot. So speaking of helpful, what about helpful resources and stuff for parents here? What can you provide some, like, where would they go? Can you provide some resources for parents, caretakers who may suspect, and maybe they don't know, but they suspect that their child might be on the spectrum?
Yes, so I would always say your first thing that you want to do is go ahead and talk to your pediatrician. That would be your first go-to. Go ahead and start voicing those concerns. I always tell parents, you know your child best. You're with them majority of the time, so you know what it is they can do, they can't do, or they should be doing, especially if you have other children too, right? And so, of course, you don't
Mhm.
want to compare your children, but you do know, like, hey, well, my son was doing this at this age, but now my other son or my other daughter is not. And so voice those concerns. You have to advocate for your child. And so once you do that, then, after you talk to your pediatrician and let's say you do the testing, from there, I would say, they should give you some paperwork and stuff about what's next, what steps are next. But I would say go ahead, Google can be your best friend and also your worst enemy. But definitely, like Google, if you start looking up, what is autism spectrum, what can I do? It will provide some of those resources for you, letting you know like who you can contact. I believe I cannot think of the name of it at the moment, but there is a website that is tailored towards individuals with autism that can give those resources and stuff to parents. So,
Okay. All right.
mhm.
So maybe it's something on the CDC
Yeah, I
there
believe it's
too. I
the.
know they have
Thank you. That is what it
resources.
is. Yes, it's the CDC.
Okay. All right.
Yeah.
Okay. Cool. Yeah. Then, and what about, like, after the diagnosis? Maybe the diagnosis positive there. What should they do next? What are those steps for seeking the right professionals and going forward?
So I would say after you receive your diagnosis, the next thing that you should do is start looking for therapy centers. So ABA therapy centers that are near you. A lot of times, that is one of the things that parents look for because they're like, okay, well, can my child go to school? Can they not? What's going to be very beneficial? So it's always important to, find the right people to talk to. For instance, we have parents who call us and say, okay, we just received this diagnosis. We don't know what to do. And for me, I believe that is the time to really ask questions of my parents. Like, what is it that you want to happen? What do you want to see? What is really important to you at this moment? From there, from just talking to, and I would say talk to more than one center. You just don't want to pick one and be like, all right, this is it, this is where I want to go. But go ahead and talk to different ones. See who really, you get that feeling that they actually care for what they do and they actually believe in what they're doing. And then from there, go ahead and say, okay, I would like to move forward with, maybe doing ABA therapy here. From there, that is when, you would talk to their BCBA to set up like your assessment. And basically what that assessment does is it gives us an outlook as to what the deficits may be, where there are some of those gaps that we may see in the milestones that your child should be reaching. And then from there,
Mhm.
that is when we start developing that plan, that treatment plan for you. With that,
Okay.
and sometimes I just lost my train of thought, but sometimes your pediatrician will also tell you, like, hey, along with ABA, look into speech therapy, look into OT. And so a lot of times they should give you the resource of different people to call, but it's also best to contact your insurance and see who they're in network
Okay.
with. And that right there, I
Okay.
think would actually, that'll take a lot of headache away. Finding out what your insurance covers and everything.
Yeah, and you mentioned a term BCBA, I believe. Can you say what that is? Describe that the
Yes.
role of that title.
So BCBA is your board certified behavior analyst. That is the person who will do the assessment with your child at the ABA therapy center. That is also the one who would implement the treatment plan. So they will write up
Okay.
everything. They're the ones who, will help with knowing, okay, this is what we're going to be focusing on. This is the direction we're going to go. And
Hmm.
so they're like I would say your point of contact. Everything that you want to know, everything that you need to know, what your child is working on, what your child will be working on.
Okay.
Mhm.
All right. And I mean, speaking of resources, I know you have a resource guide. And can you describe that resource guide and how that may be helpful to any of the parents, caretakers, out there looking for resources either before or after they've been diagnosed?
Yeah, so on our website, elitespectrumaba.com, we do have a downloadable resource guide. And what that guide does, it breaks down pretty much what to do after you receive your diagnosis. It lets you know who to contact and what steps to take. So it definitely helps kind of take some of the guesswork out that parents have whenever they get that diagnosis and they're kind of just wondering, what do I do next? So this resource guide will actually give you those steps and show you like what to do and even things that you can start doing on your own at home before you even contact, other therapy centers and things like that.
Okay, yeah, that's great to have out there as a valuable resource. As I'm sure a lot of people have been and will want to download that resource guide after hearing about it. But you touched on before, like the importance of individualized plans. You said that a few different times. Can you describe like the different treatment approaches, components? And I guess a little bit more about the importance of the individualized plans.
Yes. So very huge advocate of doing individualized plans because again, like I said, every child is different. Just because you may know one person with autism who's 4 year olds who is 4 years old, and then you meet someone else who's 4 years old with autism does not mean they're the same. And so when it comes to their treatment plan, it's very important to really focus on each person and each, area or those deficits that they show. So I may have one client who, um, you know, he's verbal, but he can't, go to the toilet. He's not toilet trained. He's unable to do little basic things like, even fix his clothes, or he cries as soon as someone walks out of the room or something like that. We're working on that. And then you may have an individual who is 4 years old also and cannot communicate at all. And so then their plan would be more so geared towards how can we get them to communicate? What's going to work best for them? So that is very important where, like I said, it's not a cookie cutter. It's not like, oh, this program worked for this kid, so it should work for this one. You always want to make sure that wherever your child goes or whatever they're doing is geared towards them and it makes sense for them. And it makes sense for, their everyday life. I don't want to, like, I've had some Spanish speaking clients and I realized that that's how they learn. And so what helped that client is changing their treatment plan and some of their targets and goals. We translated to Spanish so that way we saw like that change for them. And it was like, oh, okay. Yeah, of course, maybe this child over here, I can speak English to them all day long and they start to get it. But I had this child here because at home they speak Spanish majority of the time. I need to change the way I do things so that it's beneficial for them.
Yeah. Yeah, that's awesome, because I know for me and like most people, we want to have like more personalized understanding, how do I best learn? How can I best do this? Some people are better visual, tactile and, so on and so forth. So yes, that's very understandable and that's great to have those different types of individualized care.
Hmm.
So I want to talk more specifically about like elite spectrum ABA and your services. So, less generalized about the whole thing, but more about like what do you do? Can you describe the different services you offer and how they may be tailored to individual needs again, or even like the age groups too?
Okay.
Can you expand upon
Okay.
that?
Yeah. So, of course, we provide ABA therapy services. And then we also work with individuals so that we can provide speech as well, speech and OT. And so that is because typically, again, sometimes when these parents receive these diagnoses, is other diagnoses along with it. So we wanted to make it to where our parents are, they're not having to, okay, my child goes here, then I have to go pick them up and go do this. We wanted to make it a way where everything can be together and parents don't have to worry about how they're going to get to one place to the next. And so that's what we do here. Our age group, I think our youngest is 2 and our oldest right now is 19. So we have a very large age group. So we do, early intervention, and then we move that towards with our elders, where we do a social skills group. And so we're working on those skills. Like they may go to school majority of the time, and then they come to us to work, like I said, work on those social skills, where it's communicating, learning how to make friends, learning how to do things within their community, where they can, maybe go out and get a job. Maybe, we have some who right now, I have some of my teens who are interested in dating and stuff like that. So we work on those things too, along with, of course, the parents. But we open that door and we start working on those things with them.
Yeah, and I mean, speaking of parents, you mentioned a few different times here. So I'm wondering, what about the parents? What's their role or involvement in autism therapy, and are there any programs available there?
So I would say parents' involvement in ABA therapy is highly, highly important. And I say that because, and I think I said it before, parents spend the majority of their time with their child more than we do. And so what we don't ever want to see is that, the child is responding great to ABA therapy when they're here at the clinic and then they go home and they're not, all the behaviors are back and things are going out the window. But when parents are involved and we're doing that parent training, that's actually showing the parents, like, okay, this is what we're doing, this is how we do it. Now I want to see you do it. I want to see you put it in place. And then, I also have parents take data on what they're doing at home. So if I say, 5 times a day for a week, I want you to get your child to tell you they want one thing. So if it's juice, I just want you to get your child to say juice to you. And then I want you to take data on that. And so what that helps parents see is that they are capable of doing it and that their child is capable of doing it too. And so, it's definitely about understanding autism and understanding their child and then how they can best help their child. Again, you may not be able to do what you did with child A for child B. So it's changing the way that you interact with your kids to make, I hate to say it, but to make life easier for both of you.
Yeah, well, I mean, I absolutely can't agree with you more. I mean, on the spectrum or not, parent involvement with everything is so crucial to the child's success in life.
Yeah.
So, I mean, speaking of success now in life, like how do you measure that success, of your therapy programs? And, can you share some metrics or success stories?
Yeah. So, of course, one of the things ABA is based all around data. So we're taking data on everything that we do with our clients. And that's, is measured. There is graphed out so that I can see what's happening, what's working, what isn't working. And from that graph, that's how I decide, like what needs to change. And it can be like little minor changes to a program or something like that. But it definitely shows, how we're doing things, what we're working on, what direction we need to go in, and stuff like that.
Okay, yeah, I was going to ask about that though. So, is this like a dashboard or a sent out report specifically for, for your therapy center that parents see, or how does that work?
So once we put the programs and everything into place, one of the things that we do once we start taking data and stuff is that's where our parent meetings come in at. And so once I have those parent meetings, that's when I'm bringing up those graphs to show them, like, okay, this is what your child is working on. This is how well they're doing, or these are some of the things that maybe we have to change. Even with behaviors, so it's not just them sitting at a table or things like that, but if we're working on that elopement behavior, I'm showing them those graphs too, and also showing them what we're doing for it, what replacement behavior we've introduced to help. And so going back like to parent involvement, that's that parent meeting. So I sit down with them and let them know, like, hey, this is what we're doing. I'm gonna show you how to do it. Now I want you to try to do it at home and take data yourself too. And then I graph that data for them as well to show them like how well it's working. And it also lets me know if they are really following through with what's put in place. So that's really how we do it. As far as like success and things like that, I I honestly do can say like we have had some successes, I've had one client who he started off with us when he was very, very young. And it was the first time since we've been open that he did not have to attend ABA therapy and that he was able to be in school the entire time and stuff like that. And he's actually doing well and is functioning very well. So, just knowing what it took to get him there. And it really did. It took a village. It was the parents' involvement, the grandparents, everyone was involved with his treatment. And it made a huge
Wow.
difference for him.
Wow, that's great to hear, success stories like that. And we'll also talk more about this, and how if there's a cure, or
Mhm.
is it progress, and how much progress you can expect to get from these types of therapies. So, going back to specifically elite spectrum ABA, how can you enroll a child in one of your programs? How do you get started?
Okay. One of the ways to get started, of course, if you go to our website, you can do, I believe it's like the contact us and send us your information. You can also call us and stuff too, and you'll either talk to myself or you'll talk to Tamara. And from there, we set up a meeting and we basically just go through kind of like some of the stuff that we talked about. Your child receiving that diagnosis, what's to come, what's next, and things like that. And then usually from talking to me, parents usually decide whether they want to move forward or not. In order to move forward, like if they would like to enroll their child in a program, then, we would send them the client packet for them to fill out and everything. Once we have all that back and, we've talked to insurance and stuff, that's when we go and we set up the assessment. From the assessment, of course, that goes all to insurance. But once that's all done, that's when, the parents and we sit down and we decide on a schedule that works best for them and works best for their child. So, just because, your doctor may say, yes, they need 40 hours of ABA therapy, that may not always be the case. Or your doctor may say, oh, they only need about 10 hours. And you're like, I don't know about that. So it's definitely one of those things to really take into consideration. What do you want your child to be able to do? One of the things I always tell my parents is don't set the bar low. If you want your child to be able to achieve a goal and stuff, set that bar there. Because if you set it too low, that's as high as they're gonna go. But if you're like, no, I want my child to be able to communicate with me, no matter if it's with text or a device or verbally, well, okay, let's work on that. Let's do it. Is one of the things that is definitely, definitely important. Like what you want your child to do, your child, hopefully can do. And with the help of ABA therapy, we can get them there.
Yeah. Yeah, that's awesome. And like they say, sometimes, shoot for the stars, and sometimes you get there, and if you don't, you might just land on the moon, which is pretty good
Right,
too.
exactly. Exactly. It's like that all the time. Who's like,
Mhm.
I'm sure he's not gonna be able to tell me a full sentence, but if he can just tell me, he wants to eat, he wants to drink, or, sleep, I'm fine with it. And it's like, okay, well,
Right,
there we go.
right.
Like, we can do that.
Yep, yep. Take those steps one step at a
Hmm.
time. That's awesome.
Exactly.
So switching gears just a little bit on the let's talk about some of your like personal stories or even like your expert opinions on certain things.
Okay.
I want to ask you about your perspective on the use of medication in autism treatment and what some potential benefits and even drawbacks are of that.
So, personally, and even my professional opinion, when it comes to medication, I never open the door. At least for me, like I let parents decide like what they want to do. If that's something that they are very comfortable with and they talk to their doctor, and that's a road they want to take, you know, then I say, okay, well, that's the road you're taking. But just know, I'm no expert in what medication can do and what it can't do. So I can only tell you, okay, once you started this medication, these are the changes that I may or may not see. And so, and that's one of the things that I do, I'm very vocal about with my parents. If they decide to go that medication route, I'm like, what I'll do, I'll start tracking. And I can let you know if, we're seeing any changes with anything or if we're not. And if it's, good or bad. Because, you may say, oh, I want to try this. And you're thinking because you've read something or done, you've done some research and you're like, oh, these are the positive outcomes. That doesn't mean it's going to be a positive outcome for your child. So, it's definitely very important to understand that, and I may be jumping a little bit ahead, but there's no cure for autism. So,
Mhm.
and that is something that, parents really do need to understand.
Yeah. Yeah, and I'm curious. So, I know this is not something that you guys do, and maybe you're not, an expert like in the medication because it's not what you do.
Mhm.
But what are some of the medications that might be out there? Are they the same as some people that may not be on the spectrum, like Ritalin? Is that what we're talking about, or there's some other things?
I've heard of some children being given, that type of medication, Ritalin and stuff like that. I've even seen where parents have gone to going down the route of doing CBD oils and stuff like that too.
Mm-hmm.
So it's, and I may get some negative feedback from this, but it's not a lot of research to me out there for it. So, in my opinion, I don't always feel like it's worth going down that path because
Mm-hmm.
it's not fair. We don't know what we're getting into, and so and I believe like there's somewhere maybe like on Facebook where there are those groups that talk about, oh, we've done this with our child and we've tried these types of oils or medications and they seem to work. I just stay clear of those. Stay clear of those, and if a parent brings it to me, I give them my opinion and let them decide.
Yeah, that's right. And, I mean, of course, it's, yeah, I guess a fact, like you said, there's not a lot of research like ABA techniques that have multiple years of studies, which is what you guys do over there. So, what about not really medication, but what about the role of technology? What are they, or what are some of the benefits and limitations of the technologies that could help?
Right now at our center, we use iPads and stuff a lot. And so we use it so that some of the kids can communicate, to tell us like what they need and what they want. We have some clients who have their own devices that is their voice basically, and that's how they communicate with us. So I feel like technology in this field does play a huge part. And I'm honestly really excited to see what, AI is going to do for our field. That is something
Mhm.
that I would love to see some research and stuff done on to see how can it benefit, our clients. I feel like it could be a lot of great potential there, especially for our nonverbal clients. It can be definitely a way to give them that voice. Of course, like I said, we have the iPads and we use like different apps and stuff. But I think, this can probably take it into a whole different level.
Yeah, yeah, certainly. I mean, AI is fairly new, about a year old, being in the mainstream.
Hmm.
Really, it's been around for decades, but in the mainstream and use. So yeah, it's rapidly changing. And one of the first things about it, it's a language model, and language is huge. With the autism spectrum disorder. So I think that there definitely will be things, coming out, whether they are already or just in the near future. So,
Right, right.
let's keep a lookout for that.
Yes.
What about some other things, alternative therapies there, like music, art, and maybe are there not enough research on some of these alternative therapies? What are your thoughts on some of those?
I honestly, I don't think it causes any harm. Like, it doesn't hurt to try these other things, therapy, to try music therapy, because one of the things we know with autism, there's that sensory deficit that needs to be met. And so, doing music and art can actually, may be able to help. Just like we have children here at our clinic that love music. And so it's one of the ways that they are able to, express themselves. It's a way that, once, they are working and then they're like, okay, I want a break. They just love to go to music. When we're incorporating some of our like social skills around here, we do, have them doing some type of art and stuff. So I feel like that would be something that should be looked into. That's something that should be explored, because you just never know like what else it can unlock, what else it can help.
Yep. Yeah, I know a lot of people, myself included, agree or say, music is therapeutic. I
Right,
think we
exactly,
all can
exactly.
enjoy that.
And it's like, we all find our own ways to do things and stuff like that. And so I was like, 'cause if you just look like over time, how they've introduced, what is it? I think like the smash rooms or like the paint rooms and like all of that, that can be considered therapeutic to some people,
Yeah,
to get some
yeah,
of that
certainly.
anger and frustration out.
Uh-huh. Yep. Yeah, you
Yeah.
got to work it out somehow.
Hmm.
We'll
Hmm.
work it out more constructively rather
Exactly.
than destructively. So, can you tell me a challenging case that you had and how you approached it?
Challenging case. I think one of them would be I had a parent who really felt like ABA was the end all be all for their child, and they wanted a quick fix. And so, one of the things I really tried to convey is that ABA therapy is not a, one all be all. It's not a one size fits all. It's not something that is just going to, oh, your child just comes here a few hours a day for a couple of weeks and then that's it. That is, it's something that it can go on for a couple of years. It can go on for a few months. So we just never know. And so with that, it took a lot of, I would say, buy-in from the parent. I really had to get them to understand what we were doing and why we were doing it. And that in order for them to see some of the progress they were wanting to see, they needed to be on board as well. And it was once they started to see those changes and saw how we were getting results here at the clinic, but then at home it was a different story. It was like, oh, I guess I do need to try to do this. I guess I do need to do that.
Okay. Yeah. I mean, it sounds like it's like anything else in life. You have to put some work in to get the results.
Exactly.
It's not just a matter of, okay, well, paying some dues here, send my child off and expect everything to happen in just a limited time that you have over there. There's work between sessions that needs to be done, and a lot of thought and care from the parents and others around. I heard you mention it takes a village, right? So everybody contributing in any way that they can for the treatment of the child.
Hmm. Exactly.
So, yeah, I'd like to move into some other types of questions, some questions that have to do with myths and misconceptions here, or even debatable topics. But
Hmm.
to start with, what are some of the common myths and misconceptions about autism?
So I would say some of the ones that I've really like heard or been brought to me is, autism was caused by their child being vaccinated, or autism was
Mm,
caused by some type of environmental work that was going on in their neighborhood and stuff like that. So those are probably like two of the main ones that I've probably really heard a lot of, and that was, like I say, even said to me and asked about. I would say that there still is not enough research. We still do not know where autism comes from, like why it happens. We don't know why, your child could be walking, talking, everything from maybe 1 to 3, and then all of a sudden we see regression. That's why they say it's a developmental disability. It's something within the brain. And, they're still doing research on it.
Yep. Yep. So, I mean, I've heard some statistics. I don't know if they're right or not, but about like so many more children with autism these days than there ever used to be. Is that a accurate statistic, or do we need to also consider some other things with that stat there?
I would say that it you do see a lot more of children being diagnosed with autism. I think they say like right now it is 1 in 36 children are now diagnosed with autism, which of course is an increase from 1 in 44 just 2 years ago. So, and I don't know if that's just because more people are becoming aware of it, more people are starting to understand. And then, if you think about just, back several years ago and stuff, you probably didn't even go to school with someone who was diagnosed with autism and things like that, but they may have been diagnosed with something else. And so I think the more research that is put in and the more people are becoming aware of what's going on or aware of autism, that is allowing for individuals to be, diagnosed and even diagnosed early so that, we can go ahead and get those resources and get things in place that can be beneficial for them.
Yeah, and that kind of makes sense because just hearing the statistics on their own without anybody speaking more to it can be misleading.
Hmm.
Yeah. So, why is it important to dispel myths and promote accurate information about autism? Can it be hurtful out there if we just let these myths, ride on the way that they are without, putting out more accurate information?
I think so. I believe like it can be very hurtful to the child, very hurtful to the parents, and even just to the field of ABA. We are a science based field. And so, there's a lot of research and stuff that goes into what we do. And sometimes these myths, you can say they undermine that. They don't really take into consideration all that we put in to figuring out like what is going on or what the cause is and, how we can best assist and help. And so when you have so much information out there, like I said, Google can be your best friend or it can be your worst enemy. When you have
Mhm.
so much out there and let's say you're new to all of this, you don't really know where to go. And so you're seeing these stories and these myths, and that can be very confusing for a parent or for anyone in that, of that matter. And it's not allowing you to really, it's so hard to filter out what's real and what's not. It's hard to filter out, okay, is this really what happened? Did this really help or, or not? And so it's very important that, you're talking to the right individuals. You're talking to individuals who are in the field, who are active in the field to know, what can be done, what do I really need to know? What can help? How can I help? So I think it's I was and even what is it? I think I will say this. Facebook is probably like not the place to go look for your information from.
Yeah.
So,
Well, I mean that is one of the things. I mean, you said Google can be your best friend or your worst enemy. Same thing with
mhm,
social media, Facebook, or any
exactly.
any source
Mhm.
really out there on the internet. It's a double-edged sword.
Right, exactly.
And so I think what you're saying is consult a professional that has experience in this matter, that's, put some time in to research this and who is qualified other than just any Yahoo out there on the internet that has
Yes.
an opinion, right?
Mhm.
Well, if we talk about things that are not necessarily myths, but things that we don't know if they're, 100% accurate or true or not, just because research could support on both sides, of some issues. Are there some controversial topics or things that are being debated in your industry right now that still need to be sorted out, and some schools of thought are this way, some schools of thoughts are the other way. Is there anything like that that's kind of pressing that's going on out there right now?
I think like the biggest one that I've seen and heard um, that can be very controversial is the whole you may see things my child was cured from autism. And a lot of times like where it's been brought to me, it's been actually like celebrities and stuff like that who have children who were diagnosed with autism and then saying they were cured. And so,
Mm.
I've had parents ask like if I've read certain books from certain celebrities and things like that. And I honestly be like, no, because with me being in the field and from what, you know, research and stuff says, there is no cure for autism. And so, or your child outgrowing autism, so I believe there's a lot of controversy around that. There's a lot because you have a lot of people who look up to certain people and they're seeing all this information. And then you have people like myself who are saying, well, I've gone to school and I've done this and, you know, I'm still, I'm still learning. I'm still doing research and stuff into the field. And this is what the science is saying. So that can cause a lot of debates. It can cause a lot of controversies, but I feel like it won't go anywhere. People are going to believe what they want to believe, think what they want to think, listen to who they want to listen to. And a lot of times, I think what I've seen is that, especially like with these celebrities who've gone to say that, where these parents or just people in general put them on a pedestal. And so they're like, well, no,
Mhm.
they said this and they've done this, so I'm going to try it. And I know it's going to work. And it's like, I can't tell you not to because you're your own person and that's your child, but okay. Yeah. So I believe like that is where we're going to, like, we'll continue to see a lot of controversy.
Yes. Yeah. So now we know you said that there's not a cure for autism. You told us some of your thoughts about it, but kind of leaving on a positive note with it, with ABA therapy, what can be expected here, because we're doing something to get a result. So just to reiterate, no cure, but here's the positive aspects of ABA and some of the possible expectations and results of it.
Yeah, so I would say, of course, again, there's no cure, but with ABA therapy, our goal is to provide a lot of that positive behavior support. Our goal is to, help alleviate, some of the, I don't want to say stress that parents go through, but it's around like those behaviors and stuff. And that's what we're working on. That's what we're trying to change. And so with doing that, with again the parents buy-in to do so, with them being on board with what we're doing, our goal is to help you in in your child in their everyday life. And so yes, although there's no cure, but we can get to a place where your child isn't throwing a tantrum, throwing having a meltdown when you go into the grocery store. You're able to go to the park with your child. You're able to, your teenager who maybe you thought wasn't able to do anything is now able to have like a little part-time job or something like that. Or they're able something as simple as making their own, lunch or snack at home. So I feel like that is more positive and that's something more to look forward to and be excited about than wondering, everything else. So I feel
Yeah.
like those little changes that can help your environment, that can be socially significant for your child, you know, is what's important.
Well, that's awesome, and very positive. That's a positive note to leave off on. Well, Keisha, this conversation has been enlightening and truly inspiring. The dedication and passion you pour into making a difference in lives of children with autism shines through everything that you do.
Thank you. Thank you. I definitely enjoy, giving my, talking to you and letting you know why I got into this field and how much I like it and, what it takes to do it. as well as how we're here to help, help our parents and help our clients that we work with. That's I love what I do. I tell everybody all the time, like there's a reason I've been in this field for about what I think ooh, since 2010. So 13 years, 13 going on 14 years that I've been doing this. There's a reason that I'm here. And my goal is to just continue to learn so that I can better help and assist our families.
Well, it certainly shows that you love what you're doing. So, for anyone seeking additional information or resources, please visit Elite Spectrum ABA. The website's the same, elitespectrumaba.com. Thank you again, Keisha, for your invaluable insights and dedication. To our listeners, thank you for joining us on this journey of understanding and support. Until next time, remember, knowledge is power, and together with thoughtful action, we can make a difference.